As California's Gifford fire continues to grow with air quality watch alerts in place for hundreds of thousands of people, a new study sheds light on the health impacts of these massive fires. During the wildfires in Los Angeles earlier this year, 30 people died as a direct result, but hundreds more deaths may also be linked to the devastation. To help explain, I'm joined by one of the authors of that study, Andrew Stokes. Good to see you, sir. So you use the term excess deaths. How do you determine their correlation to a natural disaster like these fires in California? What does that mean exactly?
Well, thank you for the question, and thank you for the invitation to be here. It's very hard to attribute deaths to a wildfire or another natural disaster. The medical examiner's office, despite their very hard work, can only scrape the surface of deaths associated with such a natural disaster. So what we did was we constructed a weekly all-cause death series going all the way back to 2018, and then we forecast what we would have expected the deaths to have been if there had been no wildfires, and then we compared that to what actually happened to estimate that gap, which we call excess deaths.
So then what would the official causes of deaths be if you don't necessarily tie them to the fires, or if you do?
We think about three types of excess deaths associated with the LA wildfires. One category are these direct deaths due to direct exposure. Another category that's more nuanced are partially attributable deaths. These are people who had lung or heart conditions whose conditions were exacerbated by the wildfire smoke or stress. And then there's a third category of indirect deaths, which relate to disruptions to health systems and to the mental health impacts of the LA wildfires.
But the main impetus here is the fires, yes?
That's right. We were able to tease out the effects of the fires and kind of separate the wildfire effects from other background trends. And so we're confident that at least 440 deaths actually were attributable to the wildfires versus the official estimate of only 31 deaths.
You know, top of mind for a lot of people on the East Coast, especially the New York area, 9/11, right? We saw people getting injuries, or rather conditions, years and years later. Health complications that go on and on. Is that a possibility here, too? Could people be walking around with a kind of a time bomb in their bodies?
Unfortunately, yes. From the experience with 9/11, we know that there's a long tail of these disasters, and we worry especially about the frontline workers who so heroically gave their efforts to protecting the populace of LA and extinguishing those fires as quickly as possible.
Is there any way to get ahead of that? To warn people, look, there's danger here. I know you want to be helpful and heroic in the most, helpful way. How do you get ahead of that? Try to prevent this from happening to people with these conditions?
Thank you. I mean, on the prevention side, there's a lot we can do to make sure that the next wildfire is less deadly, including home hardening techniques and other modifications to the built environment. And we believe that estimates such as ours really highlight the importance of prioritizing these prevention efforts. And then those who are already suffering from inhalation of these toxic chemicals, we need to monitor their health moving forward to make sure they receive the proper support and screening that they need.
I remember walking around the area, Los Angeles, breathing the air, perfectly healthy, and thinking, there's some bad stuff here. I mean, what could I have done to prevent that? Wear a mask, perhaps? What else?
Yeah, we're all sick of masking. Look, it's been a long time where we had to mask during the COVID pandemic, but this is a proper precaution that one can take to prevent the worst effects of these heavy metals and these other particles that are in the air.
This kind of thing is most definitely not limited to any one region. We were talking about 9/11 on the East Coast, the fires in LA. What about going forward as climate change continues? What should we be thinking about when it comes to natural disasters and these unintended expectations?
Well, I think, this was just a staggering result, that the true burden was almost 15 times greater than the official estimate. I think we need to, include these types of estimates in routine surveillance so we can do better at disaster preparedness and response going forward.
Okay, Andrew Stokes, thanks so much for the insight.